Hi again. I'm Chloe Lance. I am the Fieldwork 2 student that we've been kind of following along the path of Fieldwork 2 in a hand therapy setting. So I just finished week 3, and I'm here to talk a little bit about how that all went. So this week I have been kind of starting to get a little bit deeper into things. I've been working with more patients, following Steph's treatment plans and carrying out full treatment sessions with a couple different patients. Um, I've been also starting to write the notes in Epic. So I finally got access after a couple hiccups to Epic, and I've been working on my note writing. We use kind of a bit of a soap note, and then kind of the own places spin on things, and that's starting to feel a lot more natural. We wrote soap notes a lot in school, but when you're writing kind of over a fake scenario like for a grade, it feels a little bit different, I feel like, than when you're doing it in person. You're doing it in a timely manner to make sure that you're getting everything covered that you need to cover, but also that you're getting it done in a timely manner. I mean, you could sit and take hours of documentation, but do we have that time? No. So I feel like that kind of just that transfer of skills, like I know what I'm doing, but it does feel a little bit different when you're doing it in person in a real setting. So I've been working on the treatments, but then I've also been kind of diving deeper into evaluations. So this week I did a couple evaluations with the help of Steph. We've kind of tag teamed it. I've done a lot of the questions, a lot of the background information, and then she's kind of helped me out with range of motion, sensation, that kind of stuff. We kind of divide and conquer. But then towards the end of this week, I kind of did my own pretty much full eval from start to finish, did all the measurements. Um, I was very nervous to do that. I was nervous when she's like, okay, you're going to do it all. And I was like, okay, I guess we're going to just go for it. But I know that she has confidence in me if she's allowing me that opportunity. So it's just kind of finding that confidence in myself to know that, I might make a mistake here and there, but she's going to be right there. She's going to be there to help me. If I have a question, it's okay to ask. I don't have to just sit there and, ponder my thoughts and that I'm not getting anywhere. If I have a question, I just ask her. And it's okay to ask those questions. It's okay to, not know everything. And I think that's kind of been my theme thus far. I know it's hard. It's really hard for me to know that I'm not going to know everything. But it is a theme. It's a theme so far, because it is something that you're learning constantly. So I can see the progression in myself. Like, okay, well, goniometry was really, really hard for me at the beginning, maybe, but then now it's slowly getting better. And then, I might have messed up on that last week, but then this week, okay, now I'm really getting it. Now the differentiation between palmar abduction and radial abduction, it became a little bit easier for me to explain, or it became a little bit easier for me to measure. So those small changes, you just have to look at the bright side and be like, okay, I am making progress. I don't completely not know anything, even though it sometimes might feel that way. You do. And your supervisor will let you know that you do know something. Steph always, she wants me to have confidence in myself. And I know that's something that I need to work on personally, but it I can feel it slowly coming into my own at this point. Um, and I feel like gathering information for evals has gotten a lot better. I've kind of found a little bit of a groove and a little bit of my flow. So it allows me to have a little bit better organization. And I feel like organization is a big one for me. not in terms of like getting all like of assignments and stuff like that. It's a little bit different than school wise. I think organization in this terms is, organizing my thoughts because I'm thinking, oh my goodness, all these things that I need to get, all this information I need to get from the patient. But if you find an organized way to kind of be like, okay, I need to do this, this, and this. So Steph's kind of walked me through her thought process and walked me through a little bit of like, okay, well, this happens first, this happens second, okay, and then we go down from there. And I feel like talking to your supervisor and being like, how do you look at this? And not everyone looks at everything the same, and you might have a little bit of differing way of looking at it, but understanding their thought process, they've been doing it for years, helps at least helps me be able to understand a little bit more about what's going on. Um, when it comes to like interpreting the information from the evals and kind of making a plan, making goals from that, I'd say that this is still an area that I'm really starting to understand more, but I still obviously need a lot of growth in. I feel like working on it right at the moment really helps me because I'm thinking, okay, well, I remember seeing this from the patient, and then I go back through their, range of motion values, and then I'm going through that and being like, okay, well, this is an area that they need to work on. And then I'll write a goal. And when I'm writing that goal, I'm thinking, okay, well, these are some things that they could do exercise wise to really meet that goal. And I also think that that just comes from, doing your research. I've been, doing research most nights after I come home. I'm kind of looking over things, looking over, different diagnoses and different information that goes along with what we might be doing the next day or what I saw today that I didn't really completely understand. So I'll kind of go back and do some research, and that has helped me to get better at treatment planning and kind of interpreting what I'm seeing in an eval. And then just a little bit about how I'm feeling in the clinic itself. I feel like I'm starting to kind of gain my footing, gain confidence in myself, and then kind of comfortable in the clinic because despite like everyone has been super kind and welcoming of a student being there, but despite that, you still know that you're kind of the not I don't want to say out I guess outcast. You're different. You're not an employee there. You're a student. But you kind of have those similarities to them. But I feel like I'm starting to kind of gain my footing. Everyone has been super kind and willing to help me out in any way. But I feel like I have started to talk to other people other than my supervisor a little bit more. And I feel like that helps kind of alleviate some of the stress when you're joking around with other professionals and you're, you know, joining in on conversations or, even joining in on getting takeout for lunch. You start to feel a little bit more like a part of something. And then that in turn helps at least me feel a little bit more comfortable. So I would say my advice is to, just be open to, talking to other people and talking about, talk about your weekend, talk about your day, talk about things that are going on around the area, because that only allows you to, start working on your interprofessional skills, start working on collaborating as a team, because if you can talk on that kind of level, it makes that professional connection a little bit easier, because it feels more natural. If you can't talk, just about your everyday life, and just something simple as where you went out to eat over the weekend, it makes it a lot harder to talk about, what you're worried about in your professional life. Or as a student, asking questions like that might be a little bit harder than, just talking about something that you feel comfortable in. So I guess my advice is to just continue to work and grow as a student by growing in the setting that you're in, and then also working outside of the time that you're there, put in the work and it will pay off. If you are putting in the work outside and understanding these diagnoses, it makes it a lot easier when you're doing an eval, when it's like, oh, this person has trigger finger. What does that mean? What does that mean in terms of how their tendons are gliding? What does that mean in terms of the pulley system in their finger? That kind of stuff starts to click, and then you're like, oh, okay, that makes it a lot easier to plan from there. So week 3's been good, and I'm excited for week 4.